What is drug-induced lupus from hydralazine? Imagine your immune system turning against your own body because of a medication. That's what can happen with drug-induced lupus, a condition where certain drugs trigger lupus-like symptoms. Hydralazine, a medication used to treat high blood pressure, is one of those drugs known to cause this rare reaction. Drug-induced lupus is a condition where the immune system mistakenly attacks the body's tissues because of a drug reaction. Unlike systemic lupus erythematosus, which is a chronic autoimmune disease, drug-induced lupus usually resolves once the offending drug is stopped. It is important to understand that not everyone who takes hydralazine will develop this condition, and certain factors can increase the risk. The risk factors for developing drug-induced lupus from hydralazine include taking the medication for a long time, higher doses, and certain genetic factors. Women and people with a slower ability to clear the drug from their bodies are also more susceptible. The symptoms of drug-induced lupus often resemble those of systemic lupus, including joint pain, muscle aches, fever, and fatigue. However, it typically does not involve the kidneys or the brain, which are common in systemic lupus. Diagnosing drug-induced lupus involves a careful review of the patient's medication history and symptoms. Blood tests are used to look for specific markers, such as antihistone antibodies, which are often positive in drug-induced lupus. Other tests include checking for anti-nuclear antibodies, which may also be present, but are less specific. Once the medication is discontinued, symptoms usually improve within a few weeks to months, and blood tests often return to normal. It's crucial to consult a healthcare professional if you suspect drug-induced lupus. They can confirm the diagnosis, advise on stopping the medication safely, and recommend alternative treatments for high blood pressure if needed. Since drug-induced lupus is reversible, early recognition and withdrawal of the drug are key to preventing long-term complications. In summary, drug-induced lupus from hydralazine is a rare but important condition caused by certain medications. It mimics some features of systemic lupus but is generally reversible once the drug is stopped. Understanding the risk factors and symptoms helps ensure timely diagnosis and treatment. Always talk to your healthcare provider before making any changes to your medication, and never stop a prescribed drug without medical guidance. Remember, individual responses vary, and personalized medical advice is essential for safe and effective care.